Hi, lovely viewers. Welcome back to the Kelvin TV. On this episode, I want us to talk about the things you need to know before going for your first clinicals, or the things you must know before your first clinicals as a student nurse or as a level 100 student. Please, this video is very important, and also all of us must know, because most of us will go to the ward and make a lot of mistakes, and most of our mistakes can lead us into getting patient infected or causing another complication to the patient condition, or we ourselves getting a disease condition from the ward, which is the reason why this video is for you, because we want to prevent the nosocomial disease that the patient has been getting, then we the nurses too has been getting from the ward. This is the reason why this video is for you. I'll urge you to subscribe, like, comment, and turn on the post notifications so that anytime I'll drop video on this channel, you'll be the first to watch. So the first thing that you need to know as a student nurse or a level 100 student going for your first clinicals is you need to know that you are just a learner, not a licensed nurse. You are just a learner, not a licensed nurse. You are just there to learn. You are just there to learn, not there to do some stuff which you have not been assigned or which is not being supervised by a staff nurse or you are in charge. Most of us will go to clinicals and behave as if you know everything in this world. Please stop that attitude. You are going there to learn, and that's the first time. Although you might know a lot, or you might have learned a lot in the classrooms before going to the ward, but please, when you go there, the ward is different from the classroom. Get that one straight. The anatomy and the physiology and the basic nursing that we are learning in the classroom, although they are going to help us in our practice, but get to know that there are different things when we go to the ward, because the ward is practical, different from the theories. So please, when you go to your first clinical, just know that you are a learner, not a licensed nurse. Just know that you are a learner, not a licensed nurse. So you need to be taught under supervision. You need to be given some stuff to do under supervision, because you don't know anything yet. You might think that you've learned about the vital signs, learned about bed making, so you know anything. But please, you need to also know, before you go to your first clinicals, you need to make sure you know or you read about your vital signs. You need to read about bed making, infection control, then patient positioning, and others. The vital signs will be the first thing that you're going to do on your first clinicals. When you go for your first clinicals, the kind of first is vital signs checking. So mostly the level 100 students or the new students will be sent to mostly the OPD to go there to learn about the vital signs. So please know this. You need to make sure you know the normal ranges, you know the importance of vital signs, then you know how to interpret the vital signs before your first clinicals. Then also you need to also get to know that you need to also get to know how to make beds. Bed making is very important. Then learn about the infection control or disease infection control. That one is very important, because you can go to the ward and get somebody infected, or you yourself infect yourself. So you need to make sure you know about the infection prevention control, know how to do all these stuff before you go to the ward. Then aside that one, you need to know about the patient positioning. Maybe when you in your first clinicals, me in my first clinicals, I wasn't being sent to the OPD. I was being sent to, I think, the males ward. That was my first clinicals. That time I know nothing, and I don't know anything about how things are being done or those stuff, but I was sent to the males ward to go there to supervise things. So I learned a lot of things there from the males ward. So you need to know how to position patients, you need to know how to turn patients in bed in your first clinicals. Aside that one, you need to make sure you know all the rules in the facility that you are going to. You need to make sure you dress well. You need to make sure you go on time, be on time, report on time. Then you need to make sure you know who you are going to report to. We have preceptors, we have you are in charge, we have the clinical administrator. You need to know all of them before your clinicals commence. Get to know all these things. Then you need to make sure your uniform is neatly ironed. Then, massa, one dress perfectly. A lot of us will go there, that will be the time. So you dress neatly. A lot of the ladies, or mostly the guys, will go there, then you need to now I yen in the trap, meow, you know, the number, please. That's not a bad thing, that's not a good thing to do. And also, you need to make sure always your name tag, is in place, like put it there, because that's what they are going to look on to call you or mention your name at the ward. Then you need to make sure you know about communication skills. You need to make sure you know about communication skills. You need to speak clearly. Then be respectful. Then you need to listen well. You need to listen well. It's going to help you. And you need to make sure you be polite to the patient, because this job can comes with a lot of blessings, at the same time comes with a lot of curses, because the way we are going to approach somebody and going to react to some situation can let you be rewarded by a blessing from a patient or get a curse from the patient. So please, you are going there for that's your first time. You're going to see a lot of things. So please be mindful of how you speak to patients, how you behave, and how you tolerate people. That one is going to help you. Then you need to also make sure you demonstrate a perfect hand hygiene. Whatever you're going to touch in the ward, make sure you first time wash your hands, and after you are done, wash your hands. When you're going to check vital signs, please wash your hands. After you are done, wash your hands. And make sure during the time that you are checking vital signs, you go with a hand sanitizer, because you are checking about maybe 50 patients vitals, and all of them comes with a lot of different conditions. So please, you need to make sure before you go to every patient or touch every patient, wash your hands. Then after you are done, wash your hands. That one will help you, or use hand sanitizers. Then the next thing that you need to is you need to protect yourself, because you are going to deal with or meet a lot of conditions at the ward. So protect yourself and know how you go about controlling yourself from certain conditions. Yes, protect yourself. Then you need to make sure that clinical can be somehow emotional. Then sometimes you need to control your emotions and control how you react to certain situations or certain things, because clinicals, you are going to, that will be the first time maybe you are going to see blood. That will be the first time you are going to see wounds, and that will be the first time you are going to also see a dead body. All these things, are part of clinical things. So your first clinic, sure you are emotionally strong, then mentally ready for the job, because you are going to see a lot of things which will not be pleasing to you. So please get to know all these things before with a pen and a notebook. You need to get some small notebook or package book that you're going to jot some things. Then you need to get a pen. Then make sure you have a pocket hand sanitizer. Then you need to boost your confidence, because you are going to see a lot of things. And when the patient sees you are not confident in yourself, they will start to suspect that you are a student nurse or you don't know what you're doing. So you need to make sure, or you need to prove to them that you know what you're doing. So due to that, you need to be confident in yourself. That is the job of nursing. Then the next thing that you need to know is you need to make sure you respect the patient's privacy. That one is very important. Make sure you respect the patient's privacy. That one is very important. Most of the times, maybe you're doing some things like catheterization to provide privacy for the patient. Not all the patient want themselves to be exposed. So please make sure you respect the patient and their privacy, and also make sure you don't talk about the patient condition to any of your friends. Most of us will go to the ward and see a lot of conditions. Please, don't do that. Make sure when you go to the clinic, whatever you see stays there. Patient confidentiality matters. If you go talk about anything, then the patient here want to take you on, darling, you are going to be in serious trouble. So don't talk about the patient. Make sure you respect his or her privacy. Confidentiality is key. Then the next thing is you need to remember you are representing the nursing profession. So you need to make sure you are representing the nursing profession, and also make sure that you don't go there to disgrace all nurses, or you are HOD. So please be careful and know what you are doing at the world. So guys, I would like to end here and urge all of you to subscribe, turn on the post notification so that anytime we drop video on this channel, you will be the first to watch.
Abisiafo, your friend me say scriptures. Me kanfo Nels Kelvin TV. Amo bibia. Abisiafo, the here ne say obefa wo phone. No wako YouTube, wako TikTok, wako Facebook, any social media handles ni bia. Ofa wo phone na okwa. No abo Nels Kelvin TV. Mbamo chow. Ebebie, ebia. Ye videos ni nyina oho. Osha na wa subscribe, na wa like, na wa comment, na wa share. Yeda mu nyina se.